All right, so welcome back to the Alchemical Life podcast. I have another guest on here today. It's one of my favorite people, and I never get to see her. This is Dr. Haley. She identifies now as an osteopractor.
I no longer identify as a physical therapist.
No, but seriously, Dr. Haley is somebody that I have been working with for, what have we been? We've been working together for...
I mean, what? It's been...
over a year.
Well, over 2 years.
Are you serious?
Yeah, Real Recovery is now over 2 years old. Yeah.
Oh my God, you moved to toddler phase.
I know.
That's awesome. She's just so smart, so knowledgeable. Like, I feel like we just fit each other so well in terms of our dynamic, our strengths, our weaknesses. And I'm so excited to have you on and be able to talk about all things PT, not PT. And so I want you to go into like what your titles are. Okay. Because when I say this bitch been in school and when I say I have not, I'm like, I don't even know how to pronounce half of the titles that she has.
Educated.
she is educated. And I'm debt free. So
well, there's that. I can't say the same thing. So,
but I'm also stupid. So there's that. But anyways, go through your titles and then we'll get into everything.
Yeah. So I am Dr. Haley Brown, osteopractor. I have a doctor of physical therapy. I have my diploma in osteopractic care. I am certified in spinal manipulation therapy, certified in dry needling.
Yes. Facts.
All
she
the
has
fun
hurt
things
me in the best way.
And I think that's all of my letters of the alphabet.
Okay.
Oh no, my biggest one. Geesh, I'd be in trouble for this one. I'm a fellow of Orthopedic Manual Physical Therapy. So
why would you get in trouble for that if you don't say it?
Because that's like the premier. Like that is the
the creme de la creme
letters. Yeah.
Oh.
So out of all of the doctors of physical therapy in the country, less than 1% have this title. So that was like when I was doing all that traveling and everything last year, that fellowship program, that was for this one. So I think it's within a 250-mile radius of Tallahassee. I'm the only fellow of Orthopedic Manual Physical Therapy and the only osteopractor.
Essentially, she is a actual certified badass.
We're trying.
Actually certified in so many things. So we both were at Momentum.
Yes.
We're going to give a little history. Okay. And then we'll get into some things
time.
related to we were both at Momentum. I, a trainer. You were having a place to begin your business in PT. And we met because I was in pain and you were here to heal me. And we became very fast friends. And a couple of things that I never really got into with you because I think we just got so into our own passion and talking about how excited we are about the things that we do and collaborating on the things that we do is I never asked you, what got you into PT, what made you want to do it, what led this decision, and then also the continual pursuit of education, and then the let me now be a business owner and let me do my own thing with this.
Yeah. And there's like obviously a big journey behind that.
Yes.
In general, how I got in PT, I knew I wanted to do something that required higher level education. I liked helping people, working with people. Thought I was going to go to med school. Shadowed a bunch of physicians when I was in high school and everything. I got a nasty volleyball injury. So long story short, they were going to try to do surgery on my ankle, but they couldn't tell me what they were going to operate on. And I was like, what? And I was
Could you tell me the
15
tendon,
years old,
please?
Right.
Yeah.
And they're like, well, we don't know. We're just going to do like exploratory surgery. I was like, so you want to cut me open when you don't know
and
what
you're
going to cut? 15.
Holy shit.
So I was like, we're going to pause that and not go down that route. I was like, so what are my other options? I'm like, well, you can try physical therapy. So I went and did physical therapy. I had the world's worst physical therapist.
See, and this is where I'm thinking the story's going to turn. You're like, I had an amazing physical therapist.
No, it was god awful. It was horrible. I walked into the clinic and the PT's like, oh, okay, like you're here for ankle pain. I'm like, yep. And they're like, cool. Well, I mean, like, you're walking. I go do the test. They're like, you're kind of strong. You can walk up and down the steps, whatever. And I'm like, but I'm an athlete. I can't run, jump, do agility work. Like, it's like 10 out of 10 pain, something stabbing me every time.
Yeah.
And they're like, well, do these exercises with this yellow TheraBand. Here you go.
No, not the yellow TheraBand.
The yellow TheraBand.
The yellow TheraBand. And let me tell you, they're like, all of our 95-year-old patients have had 100% success rate with this.
Yeah.
You should be fine.
Yeah.
Go jump.
Yeah. So in other words, I'm doing my PT, and it got so bad and so frustrating to a point of like, I was in such pain that I literally was wearing my boot and on crutches all day long in school just so I could go practice. We'd make basically a cast around my ankle with the AT, and then I would go practice, play, everything like that. But it'd be so bad I couldn't put weight on it afterwards. So like something's got to give. So we go back to the doctor, and doctor's like, all right, we're going to cut you open now. And I was like, okay, but what are you going to fix? Yeah, we still don't know. And I'm like, what? And like after MRIs and everything else, they're like, it could be XYZ, but there's nothing definitive. And I was like, there's just got to be something better. So I was like, send me to PT again, but not where you sent me last time.
Give me a different one.
I was like, I will try anything else. So it took commitment from my mom too, because I'm 15, so I can't drive. I'm living in rural Wakulla County, but there's no specialists or anything. So I was getting up. She was driving me to Tallahassee. It was over an hour away from our house, and we did 7 a.m. PT so I could miss the least amount of school possible.
Holy shit.
And that PT changed my life in 3 visits.
Wow.
In 3 visits, he looked at how I was loading my joints. He looked at my mechanics. We troubleshooted a few things. And when I tell you, within 3 visits in 2 weeks, I was back to my sport playing without pain. And I still had some work to do. But I mean, when he did that with me, I was like, this is phenomenal. This is what I want to do. You just figured out what nobody else could, and you just helped my body heal itself.
I fucking love that.
Yeah.
I love that.
So went down the journey, graduated high school with my AA degree, went right into undergrad, went right into PT school because it was a 3-year doctorate program. Yep. So ran, did all things. COVID hit in my graduation semester. So, graduated, but, didn't do the whole 9 yards, which is cool. And then it was such a weird...
It was like all these tears. Here's your paper. You get no other celebration. COVID.
Yeah. Like, I think I literally remember, like, driving in my car, and they had, like, some slideshow playing for the graduates. Yeah. And it was, like, Dr. Haley Brown. Yeah. And I was, like, on my way to Publix or something. I was like, cool.
Yeah. Like, all of this work and effort.
Yeah.
I have literally been in just a sufferfest for 3 years. But thank you for my drive-by diploma.
And student loan repayment starts next week.
No, yeah. By the way, what will also be sent to you with your diploma is your check that you need to be sending back to us.
Right, for sure. So then, I started treating in COVID, and that was such a weird time, like, as we all know. So
oh, God.
You're, like, masked up. You don't really know what's going on. And, I was frustrated in my clinicals in PT school a little bit because everything was, like, what I would call a PT mill. And there's really high name places here around Tallahassee, and I did all my clinicals at the higher name places, and I had some phenomenal CIs along the way, but they were being constrained by the business models that they were in, and that wasn't allowing them to deliver great patient care. And so basically by my 3rd week of almost every rotation, I could just look across the room and be like, ACL, week 6, post-total knee, week 12.
Because it was so cookie cutter.
It was so cookie cutter.
Now, when you say the business models that they're in, is this the overall protocol? Is this the doctor's opinion that they're saying, hey, this is what we see, so now you need to treat this? Is it all of the above? Is it more?
Yeah, it's kind of like, the insurance-driven model, because insurance will only reimburse what they want to. So a lot of people don't realize this. A lot of people want to go to a place that accepts their insurance, and that's great, right? But insurance literally tells the doctor what you can and can't do with the patient.
Yes.
They're like, sure, you could actually make them better and do what you went to school for all those years for and give them what you think they need. But we're only going to reimburse you $30 for one unit of therapeutic exercise. So if they need 45 minutes with you, that's too bad. Or XYZ. And so what happens is...
And you need to document all this. You can't just go lying either and say, F the system and whatever. This is... Like, it's not like a trainer where I have kind of free will. It's like if you are taking insurance and you're operating with insurance, everything is noted. Even if you're not, everything is noted. Everything's recorded. Yeah. Everything is there. So because you need to be able to save your ass in case stuff hits the fan.
There goes your license that you just worked all those years
Exactly.
for.
So it's not just like, well, then why can't we just still do what we want anyways and lie? You will.
Correct. And then, you're under such a productivity rating. Mm-hmm. And so it's not about, like, this is what's crazy, is like productivity for PTs and for most health insurance driven models of care. It's not about patient outcomes. It's not, did the patient get better or not?
How quick? How many weeks can we get them?
It's about how many visits did you get in? How many cows did you herd through in that one day? How many patients did you see? And then what did we get reimbursed back for billing? So,
and that's what I worked in. Yeah, I wanted to be a PT.
Yeah.
And I worked in a lot of several different offices and put in a couple hundred hours of just, intern hours, because it was something that I was like, I'm going to be a PT. Like, this is why I'm in school. Even though I was personal training at the time. And that is actually what completely turned me off from PT, was I was just like, these people, even the cool clinics, like the clinics that are like, we dope, I'm like, you guys are they're all insurance based. They were all the clinics that I had operated with were insurance based. And I'm like, this is not good. And like, even when I was a newer trainer and I didn't know shit about shit, I was like, I don't think that, like, I think that they actually could be doing more. I don't think they need to still be here. I don't think that they should be getting discharged. Like, it was just like, it's kind of like, you can just tell. You're like, something's off.
Yes. And so imagine then the frustration that I ran into of, like, my last year of PT school, when we're on clinicals and we're like going to change the world and like, change lives.
You're
and everything.
so excited.
So excited. And then it's just like all your hopes and dreams immediately get shot down. And you're like, wait, this is what my day-to-day is going to look like after all of these years of like hard work and everything. Like, this isn't what I signed up for. I signed up to get patients better, to be able to sit down, have a conversation with them, not have 4 patients at one time that I'm having to juggle through, like, to bond with patients and everything else. So I was extremely frustrated. I immediately knew that I was going to have to open my own business right there in PT school. I knew that the status quo was unacceptable and I couldn't live life that way.
Yeah.
So I started listening to podcasts, doing a lot of research on my own, talking to just other business owners in general. And, we're really on the forefront of self-pay clinics and self-pay medicine. When I was going through
because right
PT
now they're
school,
doing like a, what is that membership fee?
like the concierge.
Thank you, the concierge.
Yes.
So you're moving into
Concierge
slowly.
medicine.
Yes.
So whenever I was graduating PT school, that really wasn't a thing. There was a few people doing it. No one here around our area at
I'd
all.
never heard of it.
And so I was like, okay, like this is what I want to do. And like, even whenever I shared that information, with some of my professors or other PTs that I knew at the time, like they all laughed in my face and they were like, Haley, like there's no way someone's going to pay their hard-earned money to do PT with you. And I was like, but I'm going to get people better and we're going to get them better even faster. And they're like, yeah, sure. We'll see. So like
the villain arc begins. I'm like getting fucking hyped.
If anybody knows me, like, that I'm a super chill person.
Yes.
Until you tell me I can't do something. I can't do something. And when I tell you I will not sleep until it's done, like it's there.
And she hasn't slept since, guys. She's still not sleeping.
I think I slept more in PT school than I have since. Yeah. So long story short, graduate. I was offered jobs at all the places I did clinicals with, all the big names in Tallahassee for physical therapy, and I said no to all of them. Mm-hmm. And I met his name's Zach Verrier, and he owns Magnolia Wellness Center. He's a chiropractor, and I went in and met with him, and he didn't have physical therapy in his office or anything. And I was like, hey, like I kind of like what you're doing here. I think it's cool, and what do you think about me like starting up physical therapy inside of here? And he was like, sounds great. Let's do it. He didn't know what that looked like. I didn't know what it looked like. We were like, let's just do it. And it's interesting because even in PT school, you kind of have like this turf war between like chiropractors and like physical therapy and all that.
Chiropractors are the charlatans. PTs are saving the world.
Well, I never got it because I was like, but we all just want patients to get better, right? And like, there's good chiros out there, there's bad chiros out there, there's good PTs out there.
There's
PTs.
some shit ones. Yeah,
same things. MDs, you name it. Right, personal trainers.
There's a reason she's identifying as osteopractor now.
That's right.
Okay. All right.
So,
there's a lot of bad PTs. We're not even gonna get to the person. We'll get to the personal training later, girl. Oh Lord,
I know. So, anyways, started doing that, and then I started really realizing, how probably with personal training too. When you first started doing it, like you didn't know enough about yourself at the time. So you had to start seeing clients to start picking up like who you worked really well with.
Yeah.
who you struggled with.
And you just take anyone because you're like, I just
Right.
need to figure out what's going on. I need money.
Yeah.
I need to get experience.
Correct.
Does anybody want training?
Yeah.
Literally
exactly.
anyone.
Anybody. I
Yeah.
was like, you know, like someone like would complain a little bit about back pain. I'm like, oh, come see me. For
Yeah.
PT, you know,
Let's go.
immediately.
Yeah.
So I was like extremely uncomfortable with like spine related issues, really complex cases and all of that. And then I started working in a chiropractor office. So what do you think all my patients were? Spine. So I had to get really comfortable with that really quick, right? So I started doing all of that, and then I started collabing with Dr. Zach, and we started really talking about like his schooling, my schooling, like how we both would approach a patient. And it was amazing because instead of us just being like, well, this is my way, it was like, well, if your outcome's better that way, like let's do it that way, and then mine. And then we started getting patients, I mean, so much better and so much faster and everything else. Like it was cool, but we joked like there was like some personal injury patients and stuff like that where they were like, no, like don't make us too good too quick because like we still have to go through our case and everything else. But you know, so I did that for a year and a half, something like that, and then I got bored. I was like, is this it? I was like, you know, I have a lot of patients that I really get better and make a big improvement in life, and there's certain patients though that I'm just like, I kind of get them better, and I'm like, man, just kind of learn to deal with it, or, you know, maybe try XYZ different routes. And I was like, there's got to be more.
You got to understand, guys. Some people, like, you just old. And some people, like, you were just preventing death a little longer. And so it's hard sometimes to get excited about helping, like, 85-year-old Sally Joe. Because it's like, part of it is like, dude, you're just old. And we can get her feeling like good old, but she's still old, you know?
Yeah. Well, it's that, and it's just like, you know, nobody knows what to do with Sally, right?
Nobody knows what to do with Sally.
Everyone's scared. Sally's fragile. And
that's also true.
And, you know.
And then we go back to the yellow TheraBand.
Then you go back to the yellow TheraBand, right?
Meanwhile, I have my 85-year-old clients, and I'm like, get on the leg press.
Exactly. Exactly.
Load
Deadlift, 135. Here we go.
Let's go.
And that's what we need. That's what we need more of.
Yeah.
And we can go on that tangent, like, for sure. So after getting, you know, bored enough, and I say bored, like, I was very busy. I was still enjoying what I was doing, but I was like, gosh, like, you know me. I have this illness where, like, the second I feel like I've accomplished something, I start freaking out. Because I'm like, no, I need aspirations and goals to grow towards.
This is how we bonded, I think. we were both sitting, and you were treating me, and I was like, I need to do more. I'm bored. Yeah. And you were like, yo, me too. You were like, I really like working with athletes. I was like, yo, me too.
Yeah, for sure. So that kind of like struck me to create my own business and to do self-pay, do niche clients and everything else too. And then I was like, well, I really want to do that. So that's when I started the talks with Momentum and how I would negotiate my space and things like that. And then at the same time, because I just, you know, I got to have like multiple pots like on the stove at once.
Duh.
Like if you just have one, you just, again, you kind of get bored, right? Like I like differences and chaos in my life a little bit.
Way too healthy to be able to sleep 8 hours a night.
Right. Yeah. So I all of a sudden like had, I was doing my dry needling certification because it just gotten legalized in Florida. So I immediately was like hopping on that train.
Mm-hmm.
So I was the first DPT to be doing dry needling in this area at all. And as I was doing my dry needling courses, I was learning so much from these people. I was like, gosh, like these instructors, like they know so much. And it was like above and beyond just here's where you stick a needle, right? It was like the pathophysiology of things and everything else. And I was like, man, this is really cool. And like every instructor at the courses I went to, like pulled me aside and were like, the way you talk, the way you're acting, like you should seriously consider the fellowship program. And if you would have told Haley in 2020, graduating PT school, that I was going to do more school, I'd been like, no shot. But again, we get bored and things like that. So I was like, well, I'll apply to it and see what happens. I kid you not, in 1 month, I got my acceptance to the fellowship program, which was going to like cause me to get on a plane almost every weekend and fly all across the country. And in that same month, I got the official go ahead from Momentum. So then all of a sudden I was like, well, crap. Okay. Like I have just committed to these two things. Like normally somebody would take a year to start a business or take a year to do a fellowship and then do it other. We just went for it.
Yes.
full sended it.
One of the things I love about you.
So it was so much fun. So I went, traveled, learned so much. I was growing a business, adding on, new staff, growing, like collabing, all the things. And it's just like, it hasn't been that long, but it feels like I've been doing this all my life. And I can't imagine the life that I had before until I started doing it.
Mm-hmm. Yeah. I have, like, just in the time that I've been able to watch you, like, it has been so fun to watch, just to be able to see all of the things that you've succeeded in, and all of the ways too that you've struggled and been able to overcome as a business owner, as a PT, as an osteopractor, as like just as a human, it's just been so cool to watch. And I don't know. I mean, I'm curious to get your opinion, because when I walked into your office and I like worked with you, you kind of know when someone's full of shit and when someone's not,
Mm-hmm.
And I've worked with enough PTs, like I'm retarded, but I'm not that retarded. Like, I know enough about things to know if I'm like, this person has no idea what they're talking about, or they're like fresh out of PT school and they're like, they're memorizing the manual they put in place. You know what I'm saying? And I sitting with you, I was just like, she's excited about helping people in the way I'm excited about helping people.
Mm-hmm.
And she loves learning, and she knows her shit. And if she doesn't know her shit, she'll figure it out.
Absolutely.
And you had this like just drive to be like, I don't know what I'm doing, but we're gonna figure it out. Like, we're going for it. And it was just so contagious. Like, I would get done with talks with you and I would be like fired up. Like, I'm like, I am ready to go work. It's so exciting. So I'm curious to hear about our initial meeting and like our initial interactions, if you felt the same way, or if it was, or what.
1,000%. Like, I remember, like, you came to my office and
I think you suggested, you were like, would you work together? Would you like to work together?
Yeah, because I mean, like, you were like, talking about, I think, was it your hip that originally brought you in? The good old hip. That's always your issue?
No, it was my neck. My hip is now a second devil.
It was your neck. So
she has since been dealing with it.
I find that I have the best conversations with my patients after I put needles in them. I don't know if it unlocks like a level of
we're stuck.
We honesty can't go anywhere. Truth, or if people feel comfortable because their head is like buried in a towel in the treatment hole. But like, I have the best conversations with my patients.
There's nothing more intimate than just pants down, glutes or needles in the ass.
Yeah,
needles in your neck.
All the things.
Yes.
So I remember like we were talking, and I think you were just asking me like, like, who are you? Like, how do you come from? Like,
how you come from?
How do I trust you enough to send patients, like my clients, to you?
Yeah, we were talking because you were working with a couple of clients that I also worked with.
Yeah. And I could tell that you, and I appreciate this, and this is what I like, is like, I could tell you were testing my knowledge a little bit of like, okay, well, like my client was doing so-and-so gym movement, because it was crazy as so many PTs don't understand like actual gym movements.
Oh my God.
Like so many like doctors of physical therapy, like we have to spend all this time in a textbook. A lot of like the actual loading part gets like thrown to the side. So it was cool because like you were talking about all this, and I was talking about their programming. I was like, well, what'd you do? How'd you like load XYZ? Like, what percentage were you going for? All of that. And then me and you just started geeking out. Like, I remember.
We were riffing.
We just started going through the whole thing. And I was like, I got a needle for that.
Yeah.
Or something else. And so then you're just talking about, like, your drive. And, I mean, you were grinding hard. You had, like, more clients.
I was burnt the fuck out.
Yeah.
Yeah.
You had more clients than I think any of the other trainers.
Oh, yeah.
And, like, working insane hours.
Getting paid nothing.
There's that aspect, too. And you were just hustling, though. And you were, like, I'm not just like gonna stand there and tell them to just like haphazardly hop on this machine and just do whatever feels good. Like, you have programmed out, you have purpose, and you push your clients.
Mm-hmm.
And that's my thing too, is like with that, that's how you unlock unexpected results, right?
Mm-hmm.
That's how you take your clients' goals from being here to here.
Mm-hmm.
So I just remember me and you talking about everything, and I was like, see, now that's the type of energy I'm talking about. Because it's not common with like our age group right now, I feel like.
No, I think it's not common just in the industry in and of itself.
Yeah.
Like really true, like pursuit of excellence, because they think that, okay, well, I go to school or I get a certification or whatever and I'm done. And I just do my job.
Yeah.
So there's that. And then also, in our generation, especially. And I think that with you and me, it's like, you said it so well. I think a lot of PTs, they don't have a lot of experience on the floor. Mm-hmm. And it's not necessarily because they're lazy. Like, part of it is just like, dude, you're working so hard in PT school, and
Yeah.
they don't give you a lot of experience on the floor in
Yeah.
terms of loading people up and doing actual, like, the work, the exercises. And I did have a lot of that.
Yeah.
And why I liked working with you so much and talking with you is I'm like, she's had like direct time in textbook, and not just like me trying to look in a textbook and learn things from. It's like she had a system that she could go to school for, to be like, hey, we're gonna study this, and we're gonna study this, and we're gonna study this, and we're gonna study how it integrates, and we're gonna study how it works together. And I'm like, oh my God, like, who would have thought people put a system to learn this together? I've just been like trying to figure it out, take certifications, and you know. And so I'm like, okay, you know that, like, I'm picking your brain about all of these things, and you're kind of like, okay, so when you're on the floor and you're doing this, like, what have we found here? And I feel like it's the same as when you're talking to the chiropractor, of just like, it's not even it's a little bit of like a, hey, what do you know kind of thing, but it's more so just like hey, okay, no, seriously, what do you know? Like, I need to learn that. And I want to get your opinion on that, because you know way more about this than I do. And
this is what true collaboration is.
Yeah.
I think so many people are quick to say, like, oh yeah, we collaborate. We collaborate with other PTs, with trainers, we collaborate with the MDs and all that. Well, that loose term collaboration of like, we communicated or we sent an email back and forth.
Yeah.
Not it. But whenever you like hone in on areas of expertise, and it's important that you recognize where your expertise starts running a little low.
Yes.
And that's when you bring in the person that's going to fill that gap.
Yeah. There have been clients that have come in with actual injuries, and it's like, I know what I need to do to help them. I'm going to get one advice from Haley to make sure that what I'm doing is good, and also make sure that I'm scaling it properly and get her input. But I know what I need to do.
Right.
However, they're also in a place where I can't load them right now because they're so flared up because they have this injury. They need to see her first.
Correct.
And it's like, it's not because I have no dog in that fight, in the sense that it's not my ego. Like, I guess my ego could get in the way, but my job is to help them.
1,000%.
And so it's like, if I can't help them, I'm going to send them to somebody who can.
Yes.
And you can do a better job right now in helping them. And then when they come back to me, which is now where you're like, this is actually where I'm like, am not as good. Yep. I don't want to be as good. I don't care to be as good, whatever. Yep. I'm sending them back to Abigail, because now I need them to get some weight under them.
It's my job to get them physiologically ready for their body to take on load, and then build it bigger, better, stronger. And so, you know, like, it's like, I take a client when it just hurts for them to walk, or not even that, like they're walking fine or anything, but they're, you know, one of our clients that we're collabing on right now, who she is a runner, has been a runner her whole life. And she now has all these tendinopathies, and, you know, hormones change, ages change, things like that. And so now she is just in pain, and she can't run. It's driving her nuts, like mentally too, and everything else. Right. So we started working with her, and, you know, like, I'm dry needling, I'm changing the pH in her bloodstream. We're activating the type 1 collagen, performing cross fiber massage on her, you know, patellar tendon, things like that. I'm creating this environment where the body is ready to heal and everything.
She's literally having, there's a CNS interruption. It's like this high tone area. Yeah. It's like getting interrupted, being like, let's chill the fuck out.
Yes.
By basically exhausting it, by being like, we're going to make you so tired that you have to chill.
So we bring it all down, and I lay all of that foundational framework. And then I would be doing that patient such a disservice if I just told them to do 3 sets of 10 clamshells, XYZ, and then try to go run again. I'm like, okay, you've put in the hard work with me. Here's where you now go to Abigail, who is going to understand what you want and need from your sport or your recreational activity of choice. And you're going to know when to program power, when to program endurance, and in which muscle, because that matters. And with time.
Where do we load it? How do we load it? How do we progress it? Are we training for stability? Are we going to start building strength? Are we going to start actually being able to now add a plyometric element to things? When are we, like, how are we going to scale this? And it's not necessarily, I mean, a lot of it is from studies and things that I've looked at, but it's also from collaborating with other coaches, from talking to PTs, from, you know, being in and watching PTs and being in clinics for, you know, hundreds of hours, and then also from time on the floor, like just time that I've experienced being like, okay, this is what I did with myself. This is what I've done with all of the clients that I've worked with. This is what works. This is what doesn't. And that's where I, and we're going to start getting into like rant raves, I think, about our jobs, because we're just going into it already. But that's what I love about proper, like, good personal trainers, good coaches, is there is a lot of power in just experience. there's a lot of power in that. There's also a lot of power in education.
Yes.
And I do think that there should be a greater barrier to entry for becoming a personal trainer.
I would agree
because
with
in many ways, like, we keep people from having to see Haley. We also can be responsible for why they go see Haley.
that. Yes.
And like, people are always going to get hurt. Haley will always have business. I'll always have business, you know? But like, Haley will tell my client, just like, I don't want to see you. Like, I don't want to see you that often.
Yep.
I should not, like, now that we've fixed this issue, like, I shouldn't see you in here more than once a month.
Yeah.
I just shouldn't.
Come back. We'll keep an eye on things. We'll
Yeah.
keep things moving, grooving, feeling good. You know, we'll do adjustments, X, Y, Z.
Everyone
but,
needs a little tune-up.
Don't come back with this weak glute med tendon, because I know Abigail's put you on the program and I know what I've done on my end. So
Yes,
it's like, that's
exactly.
where we put the power in.
Exactly.
Yeah.
And so I think that's where I get where I love the aspect of my job, which is just like, man, I got to get thrown onto the floor and just be like, you got to learn and figure it out through trial and error and experience. But where I get so mad with so many personal trainers, and I'm sure you've struggled with working with other trainers, because it's like, there's also an element of, you need to have integrity to go out and do the extra work. You need to, my job will always be 60, 80 hours a week, and it's not because I'm actively training clients for that time. It's because I'm going out after I'm done and I'm like, I'm training myself, figuring out things in the room for myself. I'm experimenting on things. I'm taking another course. I'm reading a book about this. I'm listening to podcasts about this. I'm collaborating with other coaches on this. I'm doing things with my business to get back. Like, that's what a lot of coaches don't do.
Correct.
And I'm curious to see if you have any kind of issue with the PT community or with osteopractors, just in general, when it comes to, I guess it's integrity in your field, because you guys, you know, we have certifications to stand behind, but like, you guys can be like, I'm a doctor of physical therapy.
Yeah.
And I think naturally people are like, oh, trust.
Yeah.
Doctor.
Yeah.
Trust. And with us, there's a certain level of trust and there's a certain level of, you know, weight that our title carries, but it's not as much. It's like, oh, I worked with a personal trainer. I worked with a strength coach.
Yeah.
But if for you, it's like, these people are coming to you being like, she knows the stuff.
Yeah. Well, and I mean, and I think not always either, though. Oh, so I mean, like, think about your experience with all of your clients. How many of them, like, even when you first mentioned, like, oh, like, I have like a PT that I want you to go see, and they're like, no, I tried PT. PT is a waste of my time, waste of my copay money.
That's true.
XYZ.
That's true.
You don't initially have that. I've worked very hard to build like the Dr. Haley and Real Recovery reputation and brand, that people now have that trust, just like you've worked hard to build Abigail the brand and Alchemical Training the brand. And when I first started, you know, it wasn't there. I was like, okay, like, what is this girl going to tell me that I couldn't find in a YouTube video or something like that?
Yeah.
And, you know, I do get very frustrated with other doctors of physical therapy out there that aren't pushing the boundaries. Because to that point, like, we work very hard in school and everything like that. And more or less, like, anyone kind of sort of could study hard enough and pass a test.
Yeah.
And then after you pass that test, you're good. You can have a stable income and all of that. Like, there's like a minimum requirement of like a certain number of CEUs every 2 years for the state of Florida. For example.
Same with trainers, by the way.
And it's, you know, you could literally do that all via online course where you're watching TV and it's just playing on a screen.
Yep.
So it's like quality, right? And it really comes down to self-motivation. And there's so many PTs out there that, and I'm going to talk about the orthopedic world. Like, there's so many different worlds of physical therapy too, like neuro. Like, I'm sorry, if a patient with a spinal cord injury comes in and asks me to initiate treatment with them, I have no idea what to do. Like, that is not my niche. Now, I've worked with several spinal cord injury patients around their other orthopedic concerns, but I'm not teaching them how to do their bowel training and things like that. So it's about like knowing your role. But in the orthopedic world, it's the most plug and play after school of like, you kind of don't have to know much in an insurance driven model when you're kind of having referrals from doctors. And it's like to fail physical therapy to get approved for an MRI, or it's to follow a rehab protocol post-op. and all of that. Like you could kind of get okay results and live life. But that leads all of the other people that didn't have surgery, that are trying to avoid surgery, or that are trying to perform better and higher in life, that come to that same physical therapist and get terrible results, have a terrible experience, and write off PT for the rest of their life.
Which, by the way, you guys, is most people that come into those places. Like, people are not coming in only surgery, only with after break. Like, there are so many people that are going in or trying to get in places that they're just like, man, I want to run and I freaking can't, because every time I take a step, my heel feels like it's on fire and I don't know what's going on.
Yeah.
Because my shin, like the amount of pain I'm getting in these shin splints is driving me crazy.
Yeah.
And they're not getting good treatment, and they're not getting actual answers, and they're getting their symptoms alleviated, and then they're not, no root cause is being covered.
Or the symptoms aren't even alleviated. So then they go back to the doctor and they're like, yo, give me a shot, do something. Right. But, and I actually was just lecturing, so I also teach as an adjunct professor at the Doctor of Physical Therapy program here at Florida A&M. And I was just giving this lecture this morning to my students. People don't realize that the corticosteroid injections, it's called a relative contraindication for us, which means like you probably shouldn't do this. You have to be very careful if you do this with a patient, for soft tissue mobilization techniques and loading after they've had a corticosteroid injection. What sense does that make? People don't realize that those injections that the doctors are giving, because they're trying to help the patient feel better. Like, I'm not knocking the doctors on this. Like, they're addressing pain. Those same injections, their side effects, cause tendon rupture.
Yeah.
It decreases connective tissue integrity and can cause rupture.
Right. So when they come to get treatment, they are more likely to get hurt from the treatment.
Or not even that, because they've been frustrated with PT. They go and have that injection. They go live life. They step out of their truck,
and then they hurt themselves.
Goes their Achilles tendon.
And now they're back in the, yes, exactly.
Yeah. And then it's that vicious cycle. Now they're doing the post-op PT, and they're like, going through the things and all of that. So it's like, instead, whenever patients come to Real Recovery, we are the most up-to-date in research and treatment systems and everything else for holistic healing. And it's really cool and really exciting, because right now in 2025, there's more self-pay clinics than ever open right now across the United States.
Yep.
There's more education, not only at like the therapist's hands, but at the patient's hands now.
Yeah.
The power of the internet, it's a blessing and a curse.
Yes.
But everyone is now advocating for their healthcare. And it's such an amazing and exciting shift. I think that health insurance eventually is going to have no choice but to adapt and to actually start covering holistic treatments that actually work and make a difference.
Yeah.
Because the patients are starting to find it and demand it now. And like, that's like my biggest mantra with like Real Recovery and everything, is like, if I can just educate one person every single day of holistic healing methods and advocating for themselves and for their own care, that's everything. And I encourage everyone to always get second opinions. Even after they've come and seen me, I'm like, here's exactly what I would do, XYZ, here's what I think. If you don't start responding the way I think you're going to, I'm going to be the first person to tell you that, and let's go get a second opinion. I'm going to help find somebody that knows more than me in that area, and let's get it figured out.
Well, I mean, and you prove that just then in your talk, where you're just like, hey, if someone comes to me with this problem, this ain't my niche. Like, I'm gonna have to find somebody else for you, because this is not what I do. Yeah. There are certain people that I've worked with, or certain people will come in and they're like, hey, I've got this pain, I've got this thing, and I don't know how to deal with it. And they'll go get an MRI, and they come back and they've got this issue, and I'm like, this is not me. Yeah. Like,
then my text message comes through with an MRI picture. I'm like, all right, got it.
Yeah, pretty much. Haley. Well, I'm proud to say that like my clients trust me enough that if I say like, you need to call this person, they'll be like, all right, I will. And they trust that I'm not going to sit there and have them spend money on things that are not going to help them.
1,000%.
And that's just time and reputation built, which is like, dude, I'd rather you pause your training with me. Literally stop training with me and go get this shit and put the money toward getting this done, because that is going to serve you better in the next 2 weeks to a month, 6 weeks, whatever, than it would be to train with me.
1,000%. I've had more referrals, like self-referrals from other patients that I denied treatment to and sent them off to a specialist, and then they figured out a diagnosis and they're getting treated for it. I've had more referrals from those people of them telling their friends, you need to go see Dr. Haley and everything, than a lot of the people that I actually helped and got and made better.
Yeah.
Because they're like that level of trust, and like, you know, like Dr. Haley and the real recovery doctors, they're going to shoot it to you straight. They're going to tell you what they think. They're going to give you an honest opinion. And if they don't think that they can help, they're going to hold your hand and help you find somebody that they think they can.
Yeah. I think that's the biggest thing is when it comes to people's health and it comes to people's life, because they are connected.
Yeah.
It's people they don't want to be lied to.
Yeah.
Because as much as we are in our body, we are very disconnected from it in some ways.
Mm-hmm.
We don't always know what's going on.
Yeah.
And there's nothing more frustrating. And that's why I've been so passionate about getting to a place where I'm learning about human movement. Is there's nothing more frustrating than being kept from doing what you love, having your quality of life worsened, and then not knowing what exactly is causing it and not knowing how to fix it.
1000%.
And then going to some place that is supposed to say you're supposed to trust us. This is what your insurance tells you to go to, and getting lied to, not getting helped.
Yeah.
Like that is even more frustrating because now I've wasted my time and I still feel like shit.
And and then that's how unnecessary surgeries occur. That's how drug addiction occurs. Through pain pills and everything else too. And I mean, with Real Recovery, I have registered dietitians that I refer to. I have sports psychologists I refer to. I have trauma psychologists I refer to, and other NDs and chiropractors and everything else too. And it's like, I have referral sources for all aspects of health because it's all affected. And as you know, working with athletes, if they're not there mentally,
they're not there.
They might as well not even come in that day.
Yeah. It literally takes a village. Yeah. And this is something I talked about with Drew on my podcast last week, but I don't understand I don't even know why people want to be able to solve all the problems. Like, I don't want to have to solve all the problems.
Facts.
I'm fucking tired. Like, just the problems that I have to solve is a lot. Like, I'm good. I don't want any more. Yeah. So, like, why people assume that they need to be able to wear all the hats, I just don't understand.
Yeah.
And when you have a strong team around you, just how much more powerful that is. And the client is not going to think less of you. They're going to, one, think more of you. And two, like, they care about their health. Like, I know you're like, okay, well, then I got to refer them and they got to pay for this person. They got to pay for that person. I promise you, when someone is sick and when someone's injured, they will do anything to fix it. Mm-hmm. Like, I don't know if you've ever been in real pain, but I have. And I would have been like, dude, I'll pay $10,000 right now if somebody can get this shit, if somebody can alleviate this pain from my body.
Yeah.
It doesn't matter how rich you are, bro. If you feel like shit and you are sick, life sucks.
Yeah.
And so if somebody is coming to you and they need help and you are a piece of the puzzle, but you are not the whole puzzle, send them, refer them. Like, and don't be afraid to, because I promise you the people will thank you for it. Like,
for sure. Yeah, absolutely. Yeah, so I think that's like a big, like, what'd you call it? A riff?
Rant?
A rant?
Riff?
Whatever we're doing
riff.
But I think that's one of my biggest rants is PTs that aren't in tune enough with their patients, where they don't recognize that the patient isn't progressing as they should.
Yeah.
PTs that aren't pursuing continuing education of beneficial means, like that aren't really trying to improve their practice on a daily basis.
Yeah.
And just being okay with okay. And that's my rant for people in general in life. Like, I know that the world goes around and there's a lot of people out there that just want to like do the bare minimum and get by, but I don't want to surround myself with that kind of energy. Like, yeah. And I think that's why me and you get along so well. And there's so many other people that we've worked with together that, and most of our clientele, everyone's demanding more, wanting more, and wanting to push more and be better every day. And I think that's everything.
So I'm saying we work with athletes that work their ass off. Like, we owe it to them to put in effort because they're putting in effort. They put effort into their sport. They're putting effort into all of the things that they're trying to pursue in their athletic career. And it's like, I owe them that same energy.
1,000%.
And I'm not saying that I get to the end of my day and I'm like, I did awesome every day. There are some days when I'm like, could have been better. Could have put some more energy in there. Today was okay. Like, you know, or I fucked that up, or I did this wrong, or I didn't get this done and I needed to get it done. Mm-hmm. But as a whole, like, those days kind of eat at me. Like, you know, those days are the days where I'm like, whoo, yeah, let's fix that tomorrow.
That fuels your next 3 weeks. And you're like, all right, here we
let's
go.
fix that. Let's fix that tomorrow.
For sure.
And I think, honestly, I have the same kind of, I'd say with my PTs, with personal trainers, like same kind of rant. I would say it's the same, just low standards that people hold for themselves. And I think that it's even more insidious because PTs, personal trainers, can get away with it a little bit more because they don't have the DPT behind their name. They don't have the schooling behind it. They can say, oh, it was a certification, man. It's just a day job.
And there's no board holding them accountable.
Exactly.
Yeah.
It is again, it's more insidious because it's, what do you mean? Like if they really needed good care, they could go to this person. And it's like, man, you are usually the first line like of defense in terms of longevity, health, goals, whatever for these people.
Yeah.
Like if anything, you are the most important thing. You know? Do not steer them wrong. Do your best. Let's get into a rave before we hop off here today. Let's end on a positive note. Okay. Because I feel like we could rant. I feel like I know we're like fuck everything. So let's talk about one good thing before we get off that you love going on in your industry or that you just love about PTs or.
I mean, I love my job. Like I'm so blessed. Like seriously, I love getting to sit down one-on-one with people, especially with my athletes, and figure out what their goals and needs are and figure out how I can help them. I now love working with this super complex patient that has several different things wrong with them, and they've had previous injuries in all these different ways, and they haven't been able to figure out what's wrong with them yet. And like being the one that troubleshoots through all those things, like bring me the complex cases, the ones that don't fit inside of the box, all of that. So, I mean, just being able to make a difference and help people do what they want to do, and then being able to watch them progress and like them progress with you. And then like we've had clients that have gone on and done some pretty amazing things in the athletic world. And at the end of the day, seeing them on the podium and like getting that, like that shout out of like, I have an awesome team behind me and it allowed me to stand here today. And it's like knowing that you were a small part of their journey. That keeps me going.
Yeah. And I think for me, I heard this from another coach, and it's like, if you want to be a part of their wins, you need to be willing to be a part of their losses.
Oh yeah.
And I fully embrace that in the sense that I am so excited to be a part of, I don't really feel that I play a huge role in my clients necessarily in what they do success-wise. Because they have so much just time, experience, there are other sports that they're spending so much time doing. Like I feel like I play a reasonably important role, but it's small, but at the same time, like I fully embrace that when they're hurting, like what could I have done better? When they're winning, awesome. When they've lost, what could I have done better? Like I think people always want to be part of the wins.
For sure.
And I know you're the same way. It's like, we always want to be a part of the wins, and simultaneously, we are so in the trenches when we're a part of the losses too, because we embrace that as well, which is like, what happened here?
Yeah.
Could we have done something better? Did we miss something? And that's when it's like, you're on the phone with me, I'm on the phone with you, and we're like, what the fuck happened?
And a lot of times that's when I'm meeting my clients for the first time ever, when they're at their worst of their worst.
Oh yeah.
When they just had what they think is a career-ending injury, or when they have just worked multiple years towards this one event and they get injured right before it, or they get injured during it.
Yeah.
And I see them when they're in the trenches, physically, mentally, spiritually, everything else. And it's like being able to be the person that breaks it down for them of what's really wrong with them, not just throwing this like arbitrary, scary sounding diagnosis at them.
Yeah.
That they have to go Google later. Like I break it down for them and like take them through the step-by-step process and say like, hey, like this isn't going to be easy. It's going to take a team, but I can help create a plan with these other people. And like, we're all going to be here holding your hand and supporting you and like cheering you on the whole way through. And they don't believe you right then. Because they're still like, this is terrible.
They're in it.
But when you start going and you start progressing through, like the clients that then, I know you've had two that come back and they're like, holy cow, like I just did X, Y, and Z. And do you know where I was at this time 2 months ago? Like I didn't think I'd be able to run again, and different things like that. So that's the name of the game.
Yeah, man, I think for my rave with my industry as a whole is just the the accountability. I think that coaches are collaborating more instead of being like on their ego pedestal. And I think that there's more accountability for like, do better, be better. And even though it is low barrier to entry, the coaches that are really doing the work, we're not calling people out, but we're just like, we're going to keep doing the work. And we're going to keep like deliberating, talking, learning amongst ourselves and educating and really trying to get back down to the masses of people and educate them and make sure that they get led to the right place. And we will call out bullshit. Like we will call out bullshit. And I appreciate that because I think that those voices are now starting to speak louder than all of the charlatan coaches out there. And that excites me because, again, lots of knowledge everywhere in the hand of the consumer. Good and bad thing. Get thrown so much information. And the more good information I can throw at people and that other coaches they're taking accountability, saying we need to do better, we need to learn more, we need to be better, and they're throwing all that good information out, I think it's going to make just progress, success, and overall satisfaction in the gym and clients way higher.
1,000%. As we continue to rise the standard in both of our practices, there's only two things that are going to happen. Either we're just going to appear and everyone else is down here. Everyone's going to have to be forced to rise to the same occasion and pursue and do better. And I think that's all we really want, right? Because as much as you want to, you can't train every person in the world. No. And I can't treat every person in the world. No. But we can help empower the next generation, which is why I love teaching. And that's like one of my passions as a professor is to help instill that in the future generations of doctors of physical therapy to come, to where as a standard, they're coming into the field and the bar's already raised.
Yeah. Haley, you're awesome.
You're awesome, girl.
Dude, thanks for coming on my podcast.
Thanks for having me.
She's going to be a regular guest, you guys. She's going to be coming on all the time. She's going to have her own podcast out soon. Whenever she can get 5.5 hours of sleep regularly and stop doing 150 other things.
The podcast room's coming together, though. We're making progress.
She's freaking psycho, yeah. But anyway, so she'll be on my podcast again soon, or I'll be on her podcast. At some point, we always like separated but together.
For sure.
All right, you guys. I will see y'all next week. Next week, we have Veronica on the podcast. I got guest after guest after guest. Yeah, she's a pre-script coach. She's awesome. She's doing the level 3 course this coming week. And so she's going to be working with NFL Combine athletes. That's how I met her last time. So stay tuned. That's super exciting. But till next time.
Yeah.
Peace out.